This program is brought to you by Emory University.
Okay, so we're going to be covering the key plants that have been used historically to treat different respiratory conditions. We're going to be going over some of the compounds, their mechanisms of action, and so on. Here's the hit list of plants we're going to cover. Many of these you've probably even used yourself in different cold formula teas. We'll talk about bronchodilators. These are sources of compounds that can enlarge the bronchial pathways, including, again, ephedra, which has, again, what kind of activity on the small capillaries? What is?
Isn't it like a vasorepressor drug?
Vasoconstrictor, yeah, and it also has bronchodilatory effects. So not only does it tighten up some of those small capillaries, which is good for nasal inflammation, but can also help in, again, with dilation of the bronchial pathways. Theophylline, where does theophylline come from? You guys should know this from your reading. Micah? Tea. It's close. See? Theophylline tea. Very good way to remember. Comes from, what's the scientific name of tea, by the way? Of true tea.
Camellia sinensis.
Very good. Camellia sinensis. Awesome. Which family? I'll give you a clue. This is the first part of it. TAC. Okay, okay, let's go over other plants we're going to be covering are essential oils. So these are rich in what types of compounds? And you think about menthol or those minty smells, camphor, if you've ever had Bengay on your body or Vicks Vapor Rub, those kinds of things. How would you classify those compounds? Would they be alkaloids? Would they be glycosides? Yeah?
They're terpenes, right?
Terpenes, good. Terpenoids. You're paying attention to the chemistry. Very good. So these are terpenes and these volatile, very highly aromatic compounds. We're going to talk next about expectorants and mucolytics. What does that even mean? What is an expectorant? Yeah, something that helps you cough. Mucolytic, helping to get rid of some of that mucus whenever you've had kind of congestion and junk. So we have Populus, which is a relative of Salix, right? It's in the same family, in the Salicaceae. It's a related genus. And then we have Cephalus ipecacuanum, the Rubiaceae. This is the source of an old syrup that was used, especially, again, in the early 1900s in the U.S., Ipecac syrup, right? It's an emetic. So that action of the emetic action can also help in coughing up and kind of spitting out that nasty mucus. Some of the antitussives we'll cover come, one great example that's on the market still today. If you go to Europe with a really bad cough, you can find this in some countries on the market. It's formulations containing codeine. Codeine comes from which plant?
The opium poppy.
Opium poppy, Papaver somnifera. And what is an antitussive? Something to suppress the cough, so it helps to prevent you from coughing. Mm-hmm. Yeah, so pertussis is a kind of infectious disease you can now get a vaccination against. But yeah, pertussis is you have a very thick mucus. You can actually become so congested with this mucus that you can suffocate. It's like really, can be very severe in young children. Okay, we have others that are kind of soothing to the respiratory tract. If you have a very raw feeling throat, you know, when you have that horrible cold for a long time, these are demulcents and emollients. Emollient might sound familiar also to, with relevance to the skin. These are things that are softening to the tissues. So we have examples like Sambucus nigra. And do we have some, I think that we might have some from Kosovo in like one of the bags that I left. Yeah. Did you go and ask James? Yeah, I want to show that off. Sambucus is great. Tilia species, these are often Tilia and Althea and Malva all share the common factor of being from the Malvaceae family. Now, in one of the earlier lectures, we talked about one of the key characteristics of plants in the Malvaceae family is the presence of this substance. What is that substance? Think of okra. That slimy mucilage. And that mucilage that's common across many plants in this family is very soothing to the throat. So when you have a tea of these plants, just that polysaccharide, slimy texture of the plants can be very soothing to the throat. And then Tesselago farfara, which is also known as colt's foot, or Stampacavallo in Italian, for example, is in the daisy family, the Astraceae family. And then we have some examples of immunostimulants like echinacea and Astragalus, and we'll go over how some of their polysaccharide content has been linked to kind of stimulation of the immune system. What I added on to this at the end is we're going to cover some of the important biofilm-mediated infectious diseases of the respiratory system. So I literally just got back from DC about an hour or so ago. I was at a biofilm conference yesterday. So I'm all jazzed up about biofilms. Teach you guys a little extra something and how plants and plant medications might be useful for future therapeutics in that arena. Okay. Now, this is a plant you should be very familiar with by now because we covered it in last lecture on the cardiovascular system. Again, this is ephedra or moth long, which is an ancient Chinese medicine. We've covered this information already, but I wanted to include it in this lecture just to remind you that it also has significant implications for the respiratory system, especially, again, as a decongestant and as a bronchodilator. So again, in traditional preparations, you would have drops from the leaves added into the nose, or you might have a steam inhalation of the preparation. And this was used, again, to constrict the capillaries within the sinuses and also to help and have some liberation of those bronchial pathways. Remember, this was in the past and still today, if you do a Google search, you can find supplements online that contain ephedra. But again, what are some of the side effects of ephedra? Of these supplements when they're taken in an improper way? Cardiac problems, right, that can result in heart attack even among relatively healthy individuals, including athletes. Now, ephedrine is the mirror image of which compound?
Pseudoephedrine?
Yes, pseudoephedrine. This should be an easy one, guys. We just covered this last lecture. Pseudoephedrine. So we know about ephedrine and pseudoephedrine. Both of them act as bronchodilators, but pseudoephedrine does actually have less effect than ephedrine does. Same for its ability to raise the blood sugar. Yeah?
So do pseudoephedrine and ephedrine bind to the same receptors?
I'm not sure about exactly how they bind. I'd have to look that up to give you an accurate answer. Yeah. We do know from their mechanism of action that you have stimulation, indirect stimulation of this adrenergic receptor system, but I don't have the details with me right now on which exact receptors it binds to. So we do know, though, that it binds less effectively in pseudoephedrine than ephedrine does. And however, pseudoephedrine has the benefit of having less CNS or central nervous system side effects, and that's why it's preferred, especially in these over-the-counter formulations for treating sinus problems. Now, again, pseudoephedrine being the diastereomer of ephedrine, and again, the mechanisms of action being quite similar with vasoconstriction of those capillaries. We already covered this with the other compound it's linked to. What's the difference between this and methamphetamine again? Yeah.
Hydroxyl group.
The hydroxyl group. So you just cleave that off and you have, again, a very, a drug that acts right onto the central nervous system in a very strong way. Okay. Another important compound that's used for in Western medicine now that comes from a number of different botanical sources is theophylline. So theophylline is found also, it's a xanthine alkaloid, so it's structurally similar to caffeine, right? And it comes from several sources, including Theobroma cacao. What is that a picture of?
Fruit of the cacao. It's like inside the flesh.
Yeah, so that's the chocolate, the source of chocolate. The cacao pods are broken open there. Also coming from coffee species and from Camellia sinensis or tea, as we already discussed. Theophylline has been very useful in the treatment of reversible airway obstructions, including very acute asthma, kind of these very strong asthmatic attacks. Did you find it? Thank you. Oh, very nice. Great. All right. So for its mechanism of action, the main thing you need to know is that it works as a means of reducing inflammation and, again, has these anti-asthmatic effects. So don't worry about memorizing all the different specific receptors it works on. Just know the general activity that it has. Now, interestingly, again, this has a narrow margin between toxicity and therapeutic dose, and it's not used as much because the toxicity can involve cardiac side effects, including tachycardia and palpitations, nausea, and GI upset. What other drug have we covered that is actually used quite frequently but does have a very thin line between therapeutic and toxic dose? Digoxin, right, from digitalis. That's right. Okay. Now, eucalyptus is another source of, this is rich in terpenes and terpenoids that have these very aromatic compounds. It's been used by indigenous Aboriginal people in Australia. There are actually some interesting folkloric stories of healing springs and healing bodies of water where people go, and it actually is also linked, if you go on kind of ecotourism activities in Australia, these are actually linked to a lot of the trees that grow around these water bodies are the eucalyptus, and they, the release of the leaves and everything kind of contributes to that medicinal property of the spring. Now, eucalyptus oil is comes from the family Myrtaceae and has been found in, you can get it from different species. The major constituent is 1,8-cineol. And what's interesting is beyond its decongestant and kind of airway opening effects, if you ever smell this, it kind of helps you feel like your respiratory passages are opening. It's also useful as an antiseptic, so especially in topical applications and in treating or preventing insects from coming nearby as kind of an insect repellent. And it's been used in Australian Aboriginal medicine for coughs, colds, and bronchitis. Importantly, the way that it's applied is not through oral application, but rather through steam inhalation. So you're inhaling those volatile compounds that are released in the steam preparation. You can use very, very small amounts internally, but it's not recommended to do that too much. Now, another plant that's rich in these highly aromatic compounds is the camphor tree. This is in the Lauraceae. So if you think about the Myrtaceae and the Lauraceae are both commonly the sources of very aromatic, either medicinal plants or spices also in some cases, but also tend to be very aromatic. So these also camphor has, again, a decongestant effect. It's been used internally in very small amounts, but mainly as an external application or something that's inhaled. It has been removed from the market in some cases because it's rapidly absorbed across the skin and can lead to toxicity. Overdoses can include symptoms like vomiting, convulsions, palpitations, and fatality. Therapeutic doses, when externally applied and within a tolerable range, are usually taken quite well. So this is an important lesson for any of you that are interested in essential oils. Essential oils are actually really easy to make once you have the right apparatus, and you can even buy, I think there's even microwave versions for homemade essential oil extractions. But one thing to know is that you should never directly apply essential oils either to your beverages for internal use or directly to the skin, because when you extract pure essential oil, you are basically pulling out the most concentrated form of these volatile compounds, right? So you have to be very careful. And most skin formulations that contain some essential oil, it's in very low dose. You have a base solvent or a base carrier solution like olive oil or almond oil, and then a few drops of the essential oil are added as a way of eliciting a therapeutic response, but also for just the pleasure of the smell of the compounds as well. Another one that you're all probably very familiar with is menthol. Menthol, if you've ever had mint tea or just crushed up some mint leaves, you can smell it. It's quite distinctive. This has also been useful as a decongestant. Also applied in nasal sprays and inhalers. In traditional medicine, it's been used for colds and flu in many different cultures. Different species of mint have been used for this. It's generally well tolerated, but again, anytime you have high levels or high doses of the pure essential oil, you can have some toxicity. Populus, coming from the Salicaceae family, which is also the home of Salix, or the willow species, is a relative. This is being used in homeopathic remedies known as balm of Gilead or balm of Gilead. I'm not sure how it's pronounced at the end. But what's interesting is that here you have salicin and populin. Salicin is the precursor to which drug? Salicylic acid, which then is, you also have the one that we use today, which is acetyl salicylic acid that has less of those GI effects. So these are NSAIDs, or non-steroidal anti-inflammatories. From the pharmacological activity of the oil, which again is a mixture of these compounds, you have expectorant activity, stimulant, antipyretic or fever-reducing activity, which is what we would expect from an NSAID, and it can also be antiseptic. It's generally well tolerated unless you have a salicylate allergy. So if you have an allergy to aspirin, this is when we get into problems with people that take dietary supplements not understanding what's in the ingredients. If you do have an intolerance for aspirin or for the salicylates, this can actually have pretty decent levels of salicylates and related compounds that can cause some complications. Now, ipecac syrup, again, is another plant. This is used as an expectorant and an emetic. So if you, in the past, if you ever had a very severe chest congestion, or if you had something that was perhaps poisonous, accidental ingestion, in the past you would receive ipecac syrup, which is a horrible tasting thing that just really makes you vomit quite quickly of a rapid emetic response. This is due to the presence of these isoquinoline alkaloids. Alkaloids, again, tend to be very bitter in many cases. These are very bitter. You have psychotrine, emmetine, and cephaline. And however, it can also be used for, in smaller doses, for cough remedies to help in pushing out that mucus in the lungs or in the respiratory passageways. Now, in very large doses, of course, it does cause vomiting. That's how it's used medicinally in some cases, but the alkaloids can be toxic in high doses. Now, codeine, again, is another one of the compounds coming from Papaver somniferum. This is not sold over the counter in the U.S. any longer because it does contain a narcotic. I'm not sure if you can even get a prescription here. Possibly you can get it probably prescription. But there are other places in the world where you can get it over the counter as a cough syrup. It's quite effective. The toxicology of this is like with any of the other opiates. What do they do? What happens when you have opiates like morphine? What are some of the side effects? You have a slowing down of the bowels, you get constipation. You can also end up with respiratory failure because your respiration can be so reduced. This is one of the ways that with opiate narcotics that you can have prescription overdose problems, especially in the U.S. This is a problem that they're dealing with. It is an abused drug because of its highly addictive properties. But when used in the right way for treating kind of severe cough, it can be quite effective. Now we're to some of the plants from the Mediterranean, which you all know I tend to favor because that's where I work. So I'm going to show you Sambucus nigra. This is the elderberry tree. Has anyone ever had any elderberry jam? They also make it to marmalades and wines and things like that. The species that grows in the U.S. is Sambucus nigra subspecies canadensis, and it's more of a robust bush-like form in the U.S. The flowers or the inflorescences look very similar, as do the infructescences. And in Europe, it's more of it comes in the form of a tree. This is some elderberry flowers I brought back from Kosovo in October, and this was, you can open it and smell it or look at it, touch it, whatever. It's a plant that they harvest and are keeping, in particular in the Balkans. They use this as a source of herbal tea to treat respiratory problems, especially in the wintertime. So some of the major constituents in the elderflower are these triterpenes, including some of these more ubiquitous flavonoids, and also some phenolic acids. Sometimes, and it really just depends on the location and which group you're working with, sometimes they'll also add some peppermint or mentha species leaves to the tea as a preparation. Some of the pharmacological side effects is that it can induce perspiration or sweating, which in some cases in traditional medicine is seen as a sign of recovery, and so that's encouraged. And it also has some antiviral properties. So not only is this something that's soothing to the throat when it's being drunk during a respiratory event, but there have been some viral studies looking at its ability to increase inflammatory cytokine or signaling molecules that assist in response to the infection. So far, no toxicology or side effects have been reported for this in the medical literature. But when you look into the traditional medical literature, there are some other kinds of side effects that you aren't going to necessarily see in a clinical setting. So this is one of the last remaining kind of trees that's still subjected to something in anthropology that we call tree worship, or stemming from more Germanic practices of kind of nature worship. There are other examples in parts of the Mediterranean where they even cut down other species of trees and have tree wedding ceremonies, which are really interesting in the springtime to celebrate the spring. So trees are revered in some cases. Now, Sambucus nigris is very interesting because it is mentioned in these concepts of ancient tree worship, and it's not only seen as a medicinal and food plant, but also it's seen as a source of illness. So here's a little saying. This is in kind of a South Italian dialect, but it says, "Buongiorno con passavuco, ti giuro e ti prometto che dentro il fuoco non ti metto," which means, good morning, compa is like compadre, like in The Godfather, right? When you're like the best man in a wedding, you're a compadre. So compa, that's who I call the guy that was the best man in our wedding. When I see him, I say, hey, compa, how you doing, you know? So fascinating, they refer to a tree. This is a saying people say to this tree. How are you, compa, right? Like best man in my wedding or, you know, best woman. This is very interesting. And then they say, you know, I promise I will not put you into the fire. The reason they promise they will not put him into the fire or burn it as firewood is there are also some fears surrounding this plant. And another illness is called chiria alla testa, which is a kind of folk illness concerning, it's a very specific type of migraine of certain points in the head and requires a magical spiritual healing ritual. And during that ritual, they invoke the name of Compa Savuko and say basically that because someone burned it, that by inhaling the smoke of this tree, you can have this horrible headache. So toxicology, getting back to the story, is that perhaps there is some toxicology from burning the plant. Smoke inhalation might lead to a headache based on kind of folkloric evidence, but this has not really been evaluated in a laboratory yet. Other things I wanted to mention, so here is a formulation of sambucol. This is a dietary supplement. Also, you can buy, I think, here in the U.S. too, of elderberry. And you did your paper on elderberry. And Miss Kate did. She was a student of mine many years ago, and so she did a. I think I put your video on the Blackboard site possibly for this one. I don't remember if I did or not. But if not, go to the Teach Up in Botany channel, and you can watch Kate's video on Sambucus nigra. It's a very nice presentation on it. Okay. So not only important in southern Italy, but also in the Balkans, again, as a very important medicinal plant. Interestingly, in other parts of the Med, they even deep fry the flowers and will eat them, and then they also prepare the fruits in different preserves. Another plant of importance is tilia or linden flowers. You might have heard of these. These are more, these are also contain high levels of these volatile oils, including 1,8-cineol that we discussed earlier. It also is rich in mucilage, which can be soothing to the throat. And so this is being used to treat feverish colds, catarrh, which basically is this a lot of mucus and kind of things that are being coughed up, coughs, and also for influenza. Some of the side effects of taking this include perspiration. Again, in some cases, that's something that's desired to sweat out the illness in traditional medicine. And again, the richness in polysaccharide and mucilage content can be very soothing to the epithelial tissue and to the tissues in the throat, which can become raw from mucus. So far, there's not really been much done on toxicity or toxicology of this preparation. And this is of the flowers they use. Another plant of interest is Malva sylvestris. It's in the Malvaceae. So anytime you think of the Malvaceae, remember which plant? Okra. My goal is that by the end of this class, you guys will at least be able to identify okra. I don't know if you saw in the news, it was a few months ago that some police stormed an old man's house because he was growing okra in his backyard and they thought it was marijuana. I mean, they look very different. Hopefully none of you will ever make that mistake if you ever go into law enforcement and arrest somebody over okra. Okay? Different family. They look very different. But Malvaceae, remember the mucilage. So along with these mucilages, you also have a rich levels of anthocyanins, which we know are very good antioxidants, which can be good in mitigating disease as well. These are used for colds and cough, especially respiratory problems. These are traditionally harvested in the springtime, and in different parts of the Med, they're prepared in different ways. So in some cases, you'll see elderly women going off into the hillsides, and they'll come back with bags full of this stuff, and they'll make little bundles of both the leaves and the flowers all bound together that are then set to dry and then put aside for use in the wintertime. They do the collecting of the malva and the chamomile at the same time, the wild malva and wild chamomile. Now, in other parts of Europe or of Italy, for example, in Pantelleria, so to refresh your memory, Pantelleria is a small volcanic island not too far from the island of Malta, just off the Tunisian coast. It's considered part of Italy. It's in the province of Trapani in Sicily. So this is a very small island. You know, it's got a big volcano in the middle, really beautiful. This is the poison island I told you about that has all the Fabaceae everywhere, just poisonous plants everywhere. So this is Giuseppe Farina, who we interviewed, and you can see here he's got this beautiful little flower. Now this is not Malva sylvestris. This is why it's important to distinguish between common names and scientific names. This is a different species. So although they call it on this island, they call it Malva, as they do in other parts of southern Italy, completely different species. So here it's Malva or arborea, which it's a more of a robust herb that's, can be to this tall in some cases. Whereas Malva sylvestris is a very small, short herbaceous species. So I'm going to pass around some flowers of Malva or arborea that were collected and dried by one of the elderly women that we interviewed in the region. She gave this to me to use to show you guys. You can take a little look at it. And they use this again for the same purpose, though, in the treatment of respiratory conditions, especially during the wintertime. Another plant that's used often in southern Italy is Tesselago farfara. They call it stampacavallo or colt's foot. And this is in the daisy family, as you can tell by looking at the picture. One of the things that this one has going for it is the rich levels of mucilage. So although this is not in the Malvaceae family, it's in the Astralagus family, there is a high level of mucilage that can be useful in soothing the throat. Some of these mucilages or polysaccharides also have immune stimulating effects that are good for, again, promoting healing, especially of viral conditions. Now, who can spot out of these constituents which of these is a toxic constituent in the mixture? Think back to your poisons. Which of those is a poisonous constituent? Yes?
Is it the alkaloids?
The pyrrolizidine alkaloids, specifically, not just any the pyrrolizidine alkaloids can have it's at the bottom. I didn't notice that. So, but good job. The pyrrolizidine alkaloids are hepatotoxic or liver toxic, right? So this is interesting because they're using this as a medicine, but long periods of we've seen in rat studies at least, long periods of high dose are not recommended because it can lead to liver toxicity. The question comes down to, number one, does the traditional preparation have high levels of these toxic compounds? And number two, is short-term exposure really that bad? So it's finding the balance, what is the side effect of long-term use. Has anyone seen the news, the information about Benadryl and some of these compounds that's now linked to dementia for long-term use? So anytime you use those sleep aids like the Z, that says Z on the bottle, or there are formulations like Advil PM. There's some interesting studies now out at long-term use can actually lead to dementia and higher risk for kind of brain problems later down the road. So anytime you're using a drug over a long period of chronic use, there's a potential for some kinds of problems. But in short-term use, we just don't know yet on this one. Here's another mallow or another related genus to Malva. This is Althea officinalis, and if you look at it, when you see it, it can be also about yay tall. It can come in different colors. The flowers can be in different colors. It's often used as a cultivar something that's cultivated as a decorative, so it's an ornamental in gardens. But this also has nice levels of mucilage that are useful for soothing cough. But it's also been used in different applications for gastric and urinary inflammations. Now, for Echinacea, this is a plant in the daisy family again. What's interesting about Echinacea is this is, even though it's a very widely used dietary supplement, there's still a lot that needs to be done in terms of really understanding what is its mechanism of action. There are some of the effects might be due to the presence of polysaccharides, but there's also some interesting work being done now on endophytic fungi. So these are fungi that live inside the plant that are also producing interesting compounds. So if you take a look in the literature on Echinacea, they're doing a lot of interesting work trying to understand, is it really the plant that's making the bioactive compounds that are being helpful in immunostimulation and kind of recovery from viral illness, or is it actually the fungi that are living inside the plant that are making these compounds? Again, this is generally recognized as safe, but if you have any allergies to plants in the daisy family or in the Astralagus or Compositae family, then you should not take this. Here's an example from the bean family. This is Astragalus membranaceus in the Fabaceae family. This is also rich in polysaccharides and has some isoflavones. Again, it's the pharmacological effects, and these are only the ones that have been investigated this far. So you have to remember that in many cases, a lot of these plants are still under study. We're still trying to understand how they might work. But there have been some immunostimulant data on these. It also has some antioxidant and hepatoprotective or liver protective activity, and is generally well tolerated. Okay. Now we're going to look at things from the other angle. Before I do that, though, I wanted to share one more plant with you guys. This is another plant used in the Balkans, what we would call probably something that's emerging as a keystone species in the Balkans for uses in herbal teas. I'm going to let you smell this and see if you can guess what it is. Okay. See if you can smell it. It smells good. It's a very common tea in Albania and Kosovo. Yeah.
Oh, I was just gonna ask if the other plants can make it back here, because like it skipped us.
Oh, yes. Where are the other plants at that are going around? There we go. And the Malva, is that, oh, you guys are being plant hogs. Okay.
I just saw them end up over there.
Did you see them? And pass that. Okay, any guesses? This is something you've all used in your diet already. You're just not using it as a tea. I'll even give you a hint. Or actually, I want to see if you can guess the family, because you've got to get the family at least by now. Highly aromatic. There aren't that many families that are highly aromatic.
Chamomile? Chamomile?
Mm-mm. No, if you smelled it, you know it's not chamomile once you get into it. Isn't it the Rosaceae? No. No? Oh, you're looking up the volatile family. No, not Lauraceae. Good guess, though. It is one of the families with a lot of volatiles. Who here likes to cook? Let's send it to the cook in the classroom.
It kind of has like a slight smell of rosemary a little bit.
You're getting close. What family is that? Lamiaceae. So we're looking at the mint family. But what is that one? It's not rosemary, and it's not a mint. It's not basil. Basil's got big leaves. Send it back to Micah. Maybe he remembers. He might have actually pressed that one. No pressure. No? I don't think anybody's extracted it yet in the lab either, so.
Over here.
I'm sure somebody's going to guess this one. You don't get to learn about biofilms until you guys get this one right. Look at the flowers.
Yeah, I think I've had it in a tea before, but I can't think of what it is.
They use it in all types of cooking.
Yeah, does it have like a specific cuisine that
It's within the Mediterranean cuisine. Not thyme, but you're close. You're in the right family. You guys are in the right family. You're like all around it, but you haven't hit on the right genus yet. Not lavender. Also, that's in the Lamiaceae family. There's a lot of volatiles in that family. Okay, so we've gone through the guesses. It's not rosemary. It's not lavender. It's not basil. It's not thyme. It's oregano.
Wait, who said it?
It's oregano. You've all had this before. Oregano. Oreganum vulgare. In the Lamiaceae family. Now, how do we use this plant? Of course, in Italian cooking, we use it in our tomato sauces or on meats and roasts and things. But what's fascinating, again, you can have one group of people that use a plant one way, and in a neighboring territory where they have access to the same species, they can use it in a very different way. So throughout the Balkans, so we're talking about throughout Serbia, Albania, Kosovo, I believe also into Macedonia, and some of these other parts, they use this as a key ingredient in herbal teas. It's a delightful tea to drink. We don't ever get high quality oregano in our stores. The nice thing is they collect this in the wild, and it is dried often in the rafters and kind of kept there and used especially for treating respiratory kind of illnesses in the wintertime, but also as a general just healthy tea consumed for enjoyment. Now the species of oregano can be slightly different based on region as well. So for example, where I do my work in southern Italy, in central part of Italy, in Basilicata, they use an oregano heracleaticum. And this oregano is much smaller. They collect it right before or right after the grain harvest. And what's fascinating about this one is it's really at risk because the wild regions where it grows are being more and more threatened as more land is being cultivated. So you can really only find it in these very hard to cultivate rocky outcrops. So it's difficult to get up and cultivate or collect it in the wild there as well. But very aromatic, and it tastes so different from any kind of oregano we get in the stores here. It's this kind of old stuff that's sit on the shelf for a long time. You all know you should switch out your spices every year because they lose a lot of the pharmacological benefit because most spices are rich in which kind of compounds? Your volatile terpenoids that, because they're volatile by nature, they leave the plant. So you're not really getting the benefit of either the flavor, the taste, or the pharmacological benefit when they're old. Okay, so let's move on. You've now won the prize of learning about biofilms. Great prize. We're talking about biofilms in the context of respiratory infection. So I'm assuming that most of you have heard of the condition of cystic fibrosis. Cystic fibrosis is a really difficult kind of condition to treat because patients are chronically infected especially with problems of the lungs, are kind of the major factor that impacts their health. But there are other types of problems, including problems with the heart, with gallstones, with pancreatic function, digestion, sinus problems, and so on. So this is actually a genetic disease. It's due to a mutation in the CFTR gene. This has to do with epithelial chloride channels. Okay, so what happens in the respiratory pathway, in the lungs especially, is because of this mutation in the epithelial chloride channels, you have a lot of buildup of mucus. So your body is producing a lot of this mucus. And I'm going to teach you today about why mucus can be a really bad thing when it's in the body in high levels, because not only are you contributing to depletion in oxygen exchange because you've got all that mucus in the region, but it also provides the perfect breeding ground for bacteria. Bacteria love mucus, they love slime, and they love to build kind of like a fortress within this. I wish I had a better pen. These pens aren't looking very well. Thank you. Okay, I'm going to show you guys a little graph of lifespan. Now, what's interesting is when you talk to lung experts, most people consider the lungs to be sterile. Is that kind of an assumption you've gotten from other classes? But if you talk to the lung experts, actually, our lungs are not sterile. You've got constant interface with particles in the air. Things are coming in and out of your system. The difference between a healthy individual versus an individual that has a condition like cystic fibrosis is that our immune system can clear out all that kind of comes into the system. Now with, thank you. Here, let's just bring my little packer around. So if you think about lifespan, this from childhood, just born to your 30s, and this is bacterial burden. When you do swabs or samples from the respiratory fluids of these patients, you find high levels of Staph aureus in early childhood. But as they move towards adulthood, the makeup or the dynamic of the bacteria living in the lung changes. This is in CF-infected, sick patients, okay? What happens is, while you have Staph aureus, you also have Pseudomonas aeruginosa. This is a gram-positive bacteria. This is a gram-negative bacteria. Both produce biofilm, and there's evidence showing that they might actually cross-inhibit one another. So they might release some things that are inhibitory to one another. So on one hand, you have this kind of intersection. We do know that when patients get to levels of high Pseudomonas load in these swabs, that's usually around the time when their health is really failing. And again, their lifespan can only reach usually the early to mid-30s. I mean, I'd be long dead if I had CF. Not that I'm that old, but I'd be gone. It's a very, very difficult to treat infection. So in addition to Staph and Pseudomonas, you also have problems with Haemophilus and Burkholderia and a slew of other bugs that can sometimes only be ID'd through PCR techniques. Another important biofilm, and we're going to come back to what this means in terms of plants in a minute. Another important biofilm-mediated condition for the respiratory system is chronic rhinosinusitis. So you've all probably had a sinusitis event at some point in your life, hopefully not chronic rhinosinusitis, but more acute events. And this involves inflammation of the nasal passages and cavities. This is why when you have a sinus infection, you feel really intense pain up here or maybe here, because you have your nasal passages here and here. And you can see this is a healthy passage of the cavities in the septum. Here you have excess mucus, right? And this is linked with the inflammation of the lining, and you have this mucus or fluid buildup. So anyone ever flown with a sinus infection? What was it like? I was in tears. I had to fly once, and I was just, I couldn't control. It was like somebody was digging a knife into my skull when we were going down because the pressure, you're not able to really shift the pressure in your head. So if you ever have a really bad sinus infection, do not get on the plane. It's not worth it. These are some of the conditions. What's interesting is that some people can have chronic forms of this that are very difficult to treat, and they have recurrent infections. So in cases of chronic infections, what do you think that physicians usually do? What kind of treatment regimen would they give them? What do you do for like an occasional case? You might do a saline rinse, right? You're trying to cleanse out these passageways. What do you do for patients that have chronic infections? Current mode of therapy. This is not difficult, guys. This is an infectious process. What do you give patients that have an infection? Antibiotics, okay? So you usually put them on antibiotic therapy. And the main contributors to this are our friend Staph aureus and Streptococcus pneumoniae, which are also linked to otitis media or ear infections, which aren't really part of the respiratory system, right? But they're linked. There are links between the nasal passages and the ears. So you can have infection going from that area into the inner ear. Now I'm going to talk a little bit about resistance and why treating with just antibiotics doesn't work. For CF patients, it doesn't work for chronic rhinosinusitis patients. So if you are interested in antibiotic resistance, I highly recommend this nice report that was put out by the CDC in 2013. It's called Antibiotic Resistance Threats. You don't have to be a PhD in microbiology to understand this document. It's very easy to read. They have some really good statistics that are easy to follow and help you to understand some of these major problems. So in this, we know that we are facing serious threats from infections, from drug-resistant infections. There are 2 million deaths, and I'm just talking about the U.S. alone in these stats. 2 million serious infections and 23,000 deaths due to multi-drug-resistant infections each year in the U.S. What's alarming is that the antibiotic pipeline, what I mean by that, this is the drug development pipeline. These are the drugs that are being pushed forward towards the FDA. It's becoming more and more empty because of shifts in the pharmaceutical industry, because of lack of incentives by the government and regulatory hurdles from regulatory bodies like the FDA. So there are it's a very complex dynamic, but what we're left with is that for clinicians at least, they're faced with some very difficult choices because you have enteric pathogens, that means gut infections like those like Shigella, where we are on the last line of antibiotics. Gonorrhea is actually on the rise in the U.S., and it's a bad, bad form of gonorrhea. This is a gonorrhea that soon we won't be able to treat at all. So in gonorrhea, while not always, not typically fatal, can lead to pelvic inflammatory disorders in women and cause infertility. So it is a very serious problem. The CDC prioritized some of these bacteria by different threat levels. We're all about our threat levels in the U.S., red and orange. Well, they have urgent and serious threat levels. So on the urgent threat levels are carbapenem-resistant enterococci. Some examples of that would be something like Klebsiella pneumonia, which also can cause lung infections. There was actually a really bad outbreak of Kleb pneumonia, lung infections for patients at the NIH hospital that they could not get under control. It was basically being transmitted through the respiratory equipment that patients were using. There are other ones like C. diff, which you've all heard of as an anaerobic gut bug, and then gonorrhea. So some of the other serious threat levels include bugs like Acinetobacter, vancomycin-resistant enterococci, MRSA or methicillin-resistant staph, Streptococcus pneumonia, and tuberculosis, and Pseudomonas. So again, some of the ones that we have serious threat problems with in terms of resistance are also the ones that are causing some of these severe respiratory infections. And these also cause a very high economic burden The numbers are kind of all over the place, but we know it's somewhere between $28 to $45 billion in extra healthcare costs because of drug resistance in the U.S. Now, as I've mentioned before, I'm a staph person, so I'll tell you a little bit more about staph. A third of you, if I were to take some swabs and take a little swabby of your nose and bring it over to the lab, about 1 in 3 of you would have staph in your nose. And many of those are probably going to be MRSA isolates because they're widespread in the community. This doesn't necessarily mean that you're going to get sick, though. You can be a healthy carrier. To be colonized does not mean that you're infected. It just means that it exists on the skin. And this is a leading cause of many different infections that we've discussed somewhat, but this can include blood infections, brain abscesses, medical device infections, and skin soft tissue infections, but also infections in the respiratory tract, again, as discussed. Also, the staph pneumonia is quite serious, as is endocarditis or infection of the heart. Staph is just really good at infecting just about any tissue in your body, even the bone. And then there are different flavors of staph. So we have healthcare-associated infections of MRSA versus community-associated infections of MRSA. And these are phenotypically and genotypically diverse in the fact that your community-associated strains tend to be very virulent. They make a lot of toxins that cause a lot of damage to the tissue, whereas your healthcare-associated strains tend to be not as toxic, but incredibly drug-resistant. And they also tend to be very good biofilm formers. So where are we getting new drugs to treat this? I was, as I mentioned, just at this biofilm meeting where we had a lot of people from industry and also from the FDA and EPA and academics. It was an interesting group, but we're looking for different solutions from different places. A lot of our existing antibiotics came from the first picture, from the dirt. And what do I mean by that? They came from the dirt. Yeah.
You found new bacteria that secrete novel antibiotics?
Yeah, so we found bacteria and fungi, microorganisms in the soil, right, that produce secondary metabolites, these compounds, much like plants do, as part of their defense mechanism. So again, same principle we've discussed already in class with how terrestrial plants release these signals. Bacteria and fungi do the same. Other sources have included, or other places where we're looking at least, also include animal proteins. This study really caught my attention a few years ago. This is it was a study run at University of Florida where they were looking at proteins found in the blood of the American alligator that actually were very good as anti-staphylococcal agents. So we have other animal-based products that have been used in heart medications and so on. So for example, with certain snake venoms, there are animal-based medicines on the market as well. So animals can also be a source of medicine. And then we have all these other approaches of looking at chemical library screen synthetic compounds and plants and fungi and so on. What you may not know is that natural products, or again, small molecules that are inspired by natural products, make up 75% of all of our antibacterial drugs. So this does not just include plant-based products, but also other microbial products and other animal products. So we've already talked about why to look at these for the source of new drugs. Our botanical products have very rich structural diversity, right? Some of them are very large and complex, and they can be a source of inspiration for new drug design. In some cases, what people are doing are they're taking these very large, complex molecules that they're finding, and they're breaking them apart and trying to fit the puzzle pieces, the smaller pieces of the compound, to see if they can improve activity against the target. We've already gone over the strategy that we use, in my lab at least, for new drug discovery from plants, and that we're taking things that are being used in traditional medicine, subjecting them to bioassays in the microbiology lab and the chemistry lab, separating them and looking for active principles. And one thing I wanted to mention also is that we have to really question, this is something we were discussing yesterday at the meeting, is what is our end goal in new antimicrobial development? Is it to sterilize the body? What have we learned so far about the microbiome? We've touched on this briefly, but what is it? Are we healthy as sterile individuals? No, we need to have great microbial diversity in our guts, on our skin, right, to have adequate health. There have been some interesting papers that have just come out that with loss of skin microbial diversity, you have depleted immune function. So having bacteria on your skin help to train your immune system to defend against different illnesses. So what jeopardizes this or threatens this is the idea of taking drugs that confer extreme selective pressure. How would a drug confer selective pressure on an organism? Who's had microbiology? Anybody yet? Okay. How do antibiotics, things that kill bacteria, how do they confer selective pressure? Basic evolution 101 right here.
It kills susceptible bacteria and promote resistant bacterial growth.
Yeah, so you can select for basically killing off all the ones that don't have, for example, perhaps a genetic mutation that allows them to survive in the presence of that drug. So the ones that are the mutants, right, that have that mutation are able to survive while the others all die off. So you're selecting for these resistance populations to grow up. Now, this is not only relevant to antibiotics. How many of you use tea tree oil products on your skin? You may not after this. Just one person? It used to be really popular. Now it's going out of trend. Tea tree oil, it feels nice, right? It's kind of got a nice tingly sensation on the skin. What's interesting is that it has some very strong antimicrobial activity. And the way I like to compare the use of tea tree oil in low doses on the skin is almost like what it would be to apply low doses of penicillin to your skin. People can recognize, okay, penicillin is an antibiotic, it's killing something. Tea tree oil acts in the same way in that when you have repeated doses, repeated low dose exposure, you're basically cultivating tea tree oil resistant bacteria on your face. I had a student ask me, well, who cares if my face has tea tree oil resistant bacteria? Well, when you care is when a few years down the road, you have an injury or an infection and need to be on antimicrobial therapy from a pathogen that perhaps has gained tea tree oil resistance, and we don't know what all the mechanisms of action are for some of these natural product inhibitors. So if you have a similar mechanism of action, right, a similar way that it's avoiding the activity of the tea tree oil, you could have crossover of resistance to your other drugs. Natural is not always safe. But nature can be a good place to look for drugs, though. I want to make sure you guys get that message. So there's a difference between intrinsic and acquired resistance. Intrinsic resistance is what we would consider things that are genetically resistant. You have movement of genetic cassettes versus acquired resistance acquired resistance is the movement of genetic cassettes, whereas intrinsic resistance is resistance that's due to a barrier or some other kind of basic metabolic state of the bacteria that improves resistance. So the way I like to describe what a biofilm is through Star Trek. I used to be a big Trekkie fan. So you have like your Klingon ship here. Some of you have probably watched Star Trek, or at least the new versions, right? What is this green thing? I heard force field. Somebody, don't be shy. Be proud. It's tricky. Force field. So what does the force field do for the Klingon vessel? It protects it from the attack. So if you imagine that this is the antibiotic trying to get to the bacteria or the ship, it can't get through the force field. That's what a biofilm does. Think about your bacteria being surrounded by this force field. You can't get through. So what does that limit? That limits your ability of antibiotics to get through, but also the ability of your host immune system. Your neutrophils can't get through all that gunk. It's a big mucus, slime that they're surrounded in. What else happens is that when they're in this growth state, they also go into a slower form of metabolism. So they start to grow in a much more slow manner. Antibiotics work on rapidly dividing cells. So the antibiotics that can get through, maybe in that top layer of the slime, they still aren't going to work at optimum capacity because the cells aren't dividing rapidly as they should be. So there are different stages to biofilm formation and development. When they're in the body initially, let's say that one of you picks your nose and makes a little scratch in it, and you happen to have staph in your nose, it's going to enter into your bloodstream in planktonic form. Now, this is not staph. This is a flagellated, probably like an E. coli representative, right? Staph are little round cocci that don't have any tails. But when it gets into your body, it'll circulate through the system, and the first place it wants to go is to attach to a surface. People with medical devices or genetic defects, such as with cystic fibrosis, where they have all that nice mucus layer, that's where they're going to go first because it's a good place for them to stick and to start to create more of their own mucus. So you go through these different stages where they start to build more, and you end up with these towers. They look like little mushroom plumes. And in between each of the towers, what happens is you have release of waste. So all the waste goes away through these little channels because they can't live in their own waste. They have to get rid of it somehow. And they also get nutrients in through those channels. And they go into this very slow growth mode. What else happens is just like in a CF infection, they're not alone. They have very complex cities. I mean, think of this as a city with big high-rises that they're building. You have staph, you might have strep, you might have Pseudomonas or Burkholderia or Haemophilus, all in this mix living together. And when they live together, they also end up sharing genes because sometimes little clips of genes in the form of plasmids can get out into that circulating waste and nutrient kind of roadway, and you can pick up other genes. That's how we ended up with vancomycin-resistant Staph aureus, because it was actually first in Enterococci, and we know from studies that we actually acquired it, Staph acquired it from Enterococci. So, now to the plants. So this is an example of a plant that's used in traditional medicine. We've already shown you a picture of the plant, and I think I might have even had these out already. I don't remember if I showed you guys these yet, these samples. So these are, this is a blackberry bush where in southern Italy they use the leaf to treat furuncles and abscesses, kind of biofilm-mediated diseases of the skin. And this is one of 168 extracts that were screened initially for this. And we found that the roots are also used topically in formulations for hair loss. And so here we have the root chunks. This is after they're ground up into a fine powder. Kind of. And this is the final extract that we're testing. So this is after it's been processed and we've stripped out the compounds from it. Now what's cool about this plant is that when you look at the roots, it's rich in these ellagic acid glycosidic derivatives. Now ellagic acid is a difficult compound to work with because it's not very soluble in water. But when it's in its sugar form, or the glycoside form, like we've learned about, so here you have your ellagic acid is this core structure, and above that's the sugar, it's very soluble. So what's cool about this particular plant is that we've found that this extract can stop that phase 1 of attachment, right? So, but it doesn't actually kill the bacteria. So it's a true biofilm inhibitor in that it's not inhibiting growth, so you don't have that direct selective pressure on the planktonic growth or free-flowing cells, but just limits their ability to attach. So here you can see not attaching very well. As you decrease the dose, you see some appearance of some towers. And what's notable is that in this case, the morphology of the biofilm matrix, this green represents live cells, red represents dead cells. It changes. They get very tall. So instead of having a little mushroom like it normally would shape in a tower, they go into the super mega high rises, which are not actually good for, they're not super happy in that form. but it's a way of them to adapt and get around not being able to stick on that first level in some cases. Now, how is this relevant to CF and to sinusitis? Well, what was the common factor between CF and rhinosinusitis? It was Staph aureus, right? So Staph aureus colonization with biofilms is a key factor in each of those. Also, with devices, it's a major contributor to a lot of the hospital-acquired infections from device implantation. So a device could be anything from an IV catheter to a hip replacement or a knee replacement, right? So in the lab, we can take little pieces of IV catheter and grow the biofilm on the catheter. And this is just some data to show you how it works. In this case, this particular inhibitor, when you treat the IV catheter that has a biofilm on it, already established, with this plant mixture, it doesn't get rid of the biofilm, same as control, right? So then we say, well, let's treat it with antibiotics. We had to go up to 10 times the normal dose of antibiotics because, again, antibiotics can't get to the cells, right? Because of the force field, right? They just can't get through. So this is 10 times the normal dose of one of our best antibiotics. Doesn't do much. But when you combine the biofilm inhibitor with your classic antibiotic, you see great reduction in the amount that's being removed from that catheter. So this is what we were discussing at the meeting yesterday, were approaches. How can we take new technologies that are looking at antibiotic resistance from different perspectives and move this forward into the marketplace? Another bug we discussed that's important, again, to rhinosinusitis is Streptococcus pneumonia. This is also a major killer for children under 5, a major cause of ear infections and sinus infections. And what we found with this case is that this same composition, the same plant extract, behaves differently in Streptococcus pneumonia. Instead of just preventing the early attachment phase, we found that it can both prevent early attachment and it can make a biofilm lift off or disperse after it's formed, and it kills the cells. So it behaves very differently than it does in Staphylococcus aureus. But the important thing is it does work. And we've had some early animal studies that have shown that in a mouse model where they get little sinus infection in their little noses, their ears, that it works really well. So these are some of the studies we're working on in the lab right now for biofilm inhibitors that are also relevant to major conditions, infectious conditions of the respiratory system. Any questions?